you a woman in medicine feeling overwhelmed and disconnected from the personal fulfillment that you desire? You're in the right place. Join doctors Joanne and Aaron as they rewrite the rules for women in medicine. Let's begin.
What if the biggest threat to healthcare isn't disease, but the system itself? That's the question behind the documentary Suck It Up, Buttercup. But before we talk to our special guest, we want to ask you for a favor. We would love it if you could give us an honest rating and review. If you're listening on Apple Podcasts, you can go to show, scroll down and hit the starts and a comment. And that's how we get the best content for you all. And now I am so excited to have Dr. Todd Otten back with us. He was previously with us in episode 113, so you can feel free to go back there. And I'll tell you a little bit about him. He's a board-certified family physician, U.S. Navy Flight Surgeon of the Year, burnout survivor, and co-author of Ripples of Change. He is now executive producer of Suck It Up, Buttercup, a documentary exposing the broken systems behind physician burnout in America. Welcome, Todd. Thank you so much for being here with us again.
Oh, thanks for having me back. I had a wonderful time last time. And one clarification, I was only the flight surgeon of the year for the Atlantic fleet, which is another story in and of itself that we don't need to get into.
I love it. Yes, thank you. All the details. I want to get right to it. And every powerful documentary starts with a moment that makes someone say, this story needs to be told. And I want to hear, what was that moment for you?
Oh, wow. Well, there's probably two parts to this. I think ultimately I've got to give credit to my co-physician lead with this, Dr. Marianne Wilbur, and her struggles that she had from systemic abuses and ultimately stepping away. She wrote a book called The Doctor's No Longer In. And so the inspiration for the documentary really came from Marianne. I think there's three parts to, my why, if you will. You had alluded to me going through burnout and frankly, the hell of that is for those of us who've experienced in one capacity or another. But the other two parts to it are, unfortunately in my career, I've had four of my colleagues die by suicide, and including two that I was really pretty close with. And I don't want to start crying, but it was heartbreaking. And one of them, I didn't even process it for the better part of 8 years, because as physicians, we're taught to just stuff everything in a box, and there's some lunacy behind that. And then, when I was practicing in the fee-for-service world, the frustration of patients was daily, if not all-consuming at times. And so I'm driven on many levels to really want to facilitate, hopefully, massive systemic change. And I think what we're trying to deliver with Suck It Up, Buttercup has that opportunity to really, from a 30,000-foot view, pull the curtain back for the American public, how greed is destroying our system. But not just talk about the problems. We're really presenting some unique evergreen calls to action where everyone can play their part to turn this thing around. Because we need millions, if not tens, if not hundreds of millions of people behind the changes that are to come.
Todd, I've read your book, Ripples of Change, where you partner with a patient to talk about you've been a trailblazer in medicine all along. And I see this documentary as one more layer of that. And I was truly moved by listening to that book, Ripples of Change, and love that you are not giving up on a system that seems so broken, because many people see medicine as, doctors are stable and they're intelligent and they can figure things out. And yet most patients have no clue about the brokenness behind the curtain, as you say. And you've not only experienced it as a physician, you've worked carefully with a patient to unpack that. And again, those details are in the prior interview we did with you back in July, episode 113. I'm wondering, how can people really start to see the deeper things that are going on beneath the surface? And what are people missing out on when they're looking at medicine without the understanding the documentary brings?
Well, I think a lot of times, when patients are interacting with the healthcare system, they're truly just seeing the clinicians who are the tip of the spear or forward-facing part of this behemoth, if you will, that's behind. And they don't realize necessarily how much dysfunction truly exists in our healthcare delivery system, really from top to bottom. I mean, I don't know that you can point at anything and say that it doesn't have some issues attached to it. And because of that, the brunt of those frustrations are being projected at nurses, physicians, other clinicians, not just in words, but at times in violence. And that's scary that that's the point we've gotten to. And so we're hoping that by pulling back the curtain to a certain extent in a way that people can consume and appreciate and hopefully enjoy in some capacity, that they'll be like, oh my goodness, I didn't really realize this is what's happening. And even if they just treat their clinicians better, that in and of itself is going to make a small interaction, hopefully some, quote unquote, positive ripples. But we're looking for moving these efforts significantly further upstream with ultimately accelerating, an impact network. And to talk about an impact network, that's really this notion of these disparate entities that aren't working together to start collaborating, start talking, start sharing stories, start coming up with different solutions that we haven't thought of or experimented with or tried, and start doing some of those things. I think when we can start to do that, that's when we're going to really see more positive systemic change, hopefully at scale,
And I want to point out something. I see physicians and healthcare systems often working in silo. And when we can stop working in silo, I talk about with math, when you only have one number, one person, there's no math you can do. You put two people together, now you can multiply, you can do exponential growth. And one of the things I see you doing is encouraging people to come together. I know you and I met, I believe, through Kim Downey, who lost one of her physicians to death by suicide. And that created her mission, Stand Up for Doctors, and as a fierce physician advocate, and really creating these circles of communities who are, I call them disruptors in medicine, and not taking the status quo. And I think this is a good opportunity for us to encourage people who are feeling alone. I know as a physician coach, I'm still the only physician coach in my entire 2-county area. Joanne is a physician coach. We're constantly looking for ways we can improve the landscape in medicine, and this bringing people together. We'll talk about the screening of the documentary coming up, but when we stop working in silos, that's where we can really bring power and momentum. And so I would encourage our listener, if you're feeling isolated, you don't know where to go, reach out to any of us, and we'll introduce you to communities and networks that are really working towards disrupting the current medical culture for better change.
I agree 1,000% on this. Like, silo to me is almost a swear word. It's in some circles. It creates so many problems, even just trying to deliver care. You order a test on somebody and you've got to go through all these hoops to get the result back, then to go to another silo to facilitate further treatment, and so on and so forth. We need to unwind those silos, not just in delivery, but also in those who are trying to positively disrupt things. We need nurses working with physicians, working with other clinicians, working with APPs, whatever the case may be. Ultimately, we all went into this to try and help people. We've got to figure out how to stop arguing about where the comma is in a mission statement and figuring out how to actually facilitate massive systemic change. And I'm not trying to be a Debbie Downer, because there's tons of amazing groups out there that are doing this, but we need to do it faster, bigger, and significantly, as I said, further upstream to create these changes. And you're right. I think a lot of our colleagues do feel alone. I mean, that as physicians is part of how we're trained. Be resilient, be autonomous, work harder, do more. And really, some of these things have even been weaponized against us over the years, to be quite honest with you. That's got to stop. And part of how that stops is through connection. I've been doing a lot of reading about trauma recovery and all these other things. Connection mitigates trauma. And the healthcare delivery space is laced with trauma right now, layer after layer after layer, but connection helps us heal from that and hopefully move forward to a better place. I was trying to answer both questions in a somewhat consolidated way. Hopefully I did it.
And Todd, thank you so much for sharing your story and why this is intimately important for you, and loss of suicide. That's just a horrible thing. And you're speaking to our hearts as well, as that's a big part of our why Erin and I do this podcast, why we're doing all this work in physician coaching, because we understand the upstream. And I remember I have been involved in the system I used to work all along, kind of been the psychiatrist to help the physicians, not necessarily as I was eventually the coach as well. But and I remember that I was always approached like, this person has a problem, can you help them? Which I appreciate that, right? Like, because any kind of help, it's good help. But I remember thinking, has anyone looked at one, let this person get to this point and taking accountability and bringing it back to when it's not an individual problem, it's the systemic problem. Like we're speaking to a choir of why we do this work, and taking it upstream. And so proud of all of you doing this work, because we cannot just say, oh well, or that learned helplessness that we talked about in the other episode as well, in changing that. And right, and we talked so much about I think resilience is a beautiful word, but it's another bad word in medicine, because you're right. It goes against us, because we stretch, and we never stop. And that's the expectation that the system has for us. And then we just keep on going. And it's not where you like, I re-listened to that episode, and I loved how you mentioned that if the numbers of the research that shows that 50% of doctors are burned out or have significant symptoms of burnout, as a patient, when you're in front of the doctor, like how you said it, it's 50% chance that the doctor who's taking care of you is not well, right? So we have to think about it in right, like how we're serving and how we're showing up in that sense. Anyways, all that to say, like, thank you for what you're doing, and thank you for sharing in a vulnerable way, because I think it's our experience and that suffering in silence that we talk about that has to stop.
I agree 1,000% on that. And I think that's why it's incredibly important to be talking about this. Interestingly enough, since we did our first episode, through complete serendipity, I would say, I was contacted by the Paul Thomas, who was the founder of Plum Health DPC, about joining a clinic in Lansing, like 10 minutes from my house. And at the time, I still had a role with ED Group, that I'm kind of a built-in consultant, and I still have that role. And I think my first sentence to Paul was, "Paul, I'm not looking for a job," and that didn't deter him. And so we continued to have discussions. And long of the short, the ED Group that I work for was very much okay with me going back to near full-time patient care in a DPC role. And it's incredible. It's just a joy. I see 8 to 10 patients a day on average. Physicals are blocked for an hour, and I can sit there and talk about sports or the weather if that's where the conversation goes. And like that joy of medicine has returned. There isn't this clock going in the back of my head. Well, hey, oh boy, this is going to put me behind. You only got 15 minutes with this patient, and then you're going to be behind, and the whole day is going to snowball, and all these other things. Like, that's not there. And in between, you can breathe.
Todd, just because even as physicians or healthcare providers, our listener may not understand the impact and what exactly a DPC is. I know I've done a ton of learning in the last year about DPC and concierge medicine. Do you mind just highlighting some of the differences and why that was something you were willing to go into when going back to traditional corporate medicine was not?
So there's definitely some, granted, I'm new in this role. I've been with Plum Health for just over a couple months now, so I wouldn't consider myself a DPC expert at this point. I think there's others who could speak to it more eloquently than I probably know enough just to be dangerous at times, I suppose. There's definitely a subtle distinction between concierge and DPC. I probably would focus more on DPC because that's what I'm doing, but it's more of a subscription-based model. For example, with Plum Health, for $85 a month, you get amazing access to your clinician. A certain set of labs are included, and deep discounts on medications that are often available at the clinic themselves. But the beauty of the model is you're basically bringing back that beautiful relationship between the patient and the physician. And you're cutting out all the fat that currently exists in many places around the country. And so you can provide an amazing high quality level of care at just a fraction of the cost. I'll give you some just recent examples. Literally there's 4 clinicians in the office here and a handful of support staff. And, if the phone's ringing, I'll pick up the phone, and, hey, Plum Health, Dr. Otten. And oftentimes that'll lead to that person coming in for an appointment today. And I'm not going to get into the specifics of the case from a couple of days ago, but I guarantee that kept that patient out of the ED. Guarantee it. And that patient's come back for a couple follow-up visits and is doing amazing, significantly better than what was going on the other day. In the traditional fee-for-service world, good luck getting an appointment the same day. Person probably would have ended up in the ED, and thousands of dollars of bills later, and who knows how many tests and referrals and all these other things. That's the magic of it, right? It really streamlines the process and brings those two entities much closer together, which is really the way it should be.
And what I see is it's a win for the patient and it's a win for the provider because they're both empowered and in control instead of others who aren't the patient or the provider dictating what they can and can't do. So to me, it's this kind of freedom-based. And when patients are willing to pay for the service, high quality service, just like you would pay for high quality anything else, and recognize the value of that, to me, it's just win, win, win. And my hope is that more providers and patients learn about this, because I see it as one of the rebuilds of medicine, separate from corporate medicine, that might save medicine in the long run.
I agree. And to double click on that even more, Erin, I think smart self-funded employers are starting to incorporate these models into their offerings for their employees, because you're going to save almost instantaneously 20%, if not closer to 40% in terms of total expenditures by doing something like this. And why? Because patients can get in. You can deal with things, again, further upstream before they become this big problem and someone lands in the ED. So yeah, I think there's a lot of people who are learning about this and exploring. And, a lot of patients come in and they want to know more. And they're like, well, what is this? Is this a Ponzi scheme? How can you offer this? Like, how does this work? And then you explain it to them and they're like, oh, yeah, let's do it. I'm in. Let's set up the blood work and I'll see you back for a physical. And it's fun. It's a luxury to have an hour with somebody and truly dig into what their issues are, instead of saying, hey, here's a GLP-1 to help you lose weight, but actually look at what they're doing, realize they are making good changes, they are having successes, they don't necessarily need a GLP-1, see them back in 3 months, set a target, and empower them. It's awesome.
And I'm going to repeat some words that I said in our last episode. What I hear is hope. And I love this conversation that we can talk about some of the big struggles and challenges, because we cannot hide those. And at the same time say there are things that we can do to create upstream change and work on the changing the culture, with I think we're all doing in some way or another. And at the same time, also taking it inward in what can I do to change my reality, and I remember talking with you the last time that it's not like we snap our fingers and decide to be better, but okay, do I need professional help? Do I need to see a therapist? Do I hire a coach? And like, I've been on both sides of getting coached that changed my life, and having the honor of being the coach of so many people who have said to me, you've changed my life. And I love your words. I have joy in medicine again. That's just, my heart is like full right now. And I've had a similar experience. And when we recorded, I was still in transition, and I left my corporate job of 18 years and started my own private practice in psychiatry. And it's that same feeling of, I love what I do as a psychiatrist. And then it's giving me also flexibility to do these other things, like expanding this podcast and expanding in our coaching. And I hope that the listener who might be at a time of overwhelm or feeling stuck or at the edge of burnout and not even recognizing it, to first the compassion that a lot of us have been there, that there are systemic things that get us into that position, but then also hearing there's a path to this hope, to the forward movement, to find that joy again. And joy might seem like a big word for some people right now, but it's possible. And finding those little moments, like we've talked throughout the day, that remind us of what's important, and what you're saying of reconnecting to the why of what's important to us, and the ripple effect, right? Like that we can create coming from that good energy. So I'm glad that we're having this conversation.
Well, you reminded me of learned helplessness, right? I mean, that's pervasive in healthcare right now. People are, in many instances, are literally just putting their heads down, blinders on, going through their day, and just trying to survive, right? And that's eventually a lot of individuals just become a shell of themselves. And one of the calls to action for the documentary Suck It Up, Buttercup is to unlearn learned helplessness, right? We need to realize that our efforts do matter, not just externally, but also internally. And then the corollary to that, the other part of in accelerating an impact network, we're hoping through the film that people will feel empowered to go to the website where there will be all these amazing organizations, podcasts, coaches, other opportunities for individuals, depending on where they want to spend their energy to make change, to take advantage of that. And if it almost gives me a feeling of imposter syndrome at times, like, holy smokes, how did I get here? Where we're on the verge of impacting, I think, is not just going to be thousands of people, but potentially millions of people if this does what we think it can do. That's going to be hard to ignore, and if organizations start to understand, like, you know what, we need to figure out how to put aside our differences and figure out how to work together to consolidate that energy, that's when things are going to be hopefully unstoppable, and in terms of the tide of positive change challenging the existing status quo.
I want to share with you, Todd. I don't know if you've heard of this. There's a documentary called The Day Iceland Stood Still. It came out in 2023. It seems very relevant. I was flying to Iceland. I saw this documentary, and it happened in 1975. And it was either 80 to 90% of women in Iceland walked away for an entire day, their corporate jobs, their parenting. They delivered their children to their husbands who were at work and said, I'm done, no cooking, no cleaning. 2 women on a ship that cleaned and did the ship work barricaded themselves in their room and were threatened by the captain of the ship to be, I don't know, is it court-martialed or whatever, like military, whatever the law is on the sea. You know this better than I do. Anyway, The Day Iceland Stood Still is a documentary, and it shares not only what happened after 1975 when these women walked out to say, we are important, we're getting underpaid. Changes started happening. Women started being more in the government. One of the women who participated became the president of Iceland and was in office for 16 years, very beloved. And this documentary is game-changing. It helped me better understand this event that happened back in 75. So this gives me amazing excitement. I get to go to the documentary and meet with you in person shortly after this episode comes out in Baltimore. And I don't want to underestimate the power that your vision, along with the group that started this, can have on medicine, not only in the US, but maybe in other countries that are struggling like we are.
Aaron, I agree with you. I've actually just thought about, the microcosm of the event in Baltimore. We're anticipating, I think, 150, maybe 200 people there. God willing, that number will maybe go up a little bit more. But regardless, some of the people that are coming, such as yourself, are incredible human beings and change agents. And at times, it just warms my heart to think about, well, what if this person meets this person? And then who knows what comes of that interaction, relationship, friendship, what have you, and what that could blossom into. It's to me, it's just this incredible opportunity. And frankly, I think this is potentially going to be just the beginning. There's some pretty big organizations who who have gotten on board with this and are planning to accelerate this, the documentary around the country. And I'll give you just an example. Ron Turker has become a friend, recently retired, great guy, great author. In fact, his book, The Wandering Jew of St. Salacious, is a fantastic read if you ever have a chance to read it. But Ron wants to do sort of this rural tour of the documentary around Oregon. And I'm thinking, okay, well, we highlight Orchid Health in the documentary, who's delivering care in rural Oregon. How do we then potentially combine those forces to do this, tour of the documentary? And what are the results going to be of that?
And I'm in Oregon, you know that, right? And
yeah.
The Medical Society Board and the statewide Oregon Wellness Program. And so I've been chomping at the bit to hear from you. Okay, what's going on in the Northwest? Because I've just been, my brain has been exploding with ideas just during this conversation about, fundraising and about raising awareness about so many things that this documentary opens up. And again, that power of Ron was somebody that I referred to back when I was practicing general pediatrics a million years ago. And because of our connection, that reconnected. And so I'm looking forward to seeing where that leads.
Well, at a minimum, I could give you the date I believe it's happening on, May 31st in Portland, Oregon. We're anticipating that will be the date for a screening of Suck It Up, Buttercup.
Excellent.
And I'm in Texas. Whenever you guys come here, let me know.
Oh, Joanne,
the small
we both travel a lot.
Texas.
I'll tell you this, like sort of the layers of getting this project to the finish line and some of the obstacles that have occurred or speed bumps or what have you. It's just things you don't even think of. And distribution. So we're in the process of working towards getting this onto a big streaming service, which that in and of itself is quite the undertaking. So truly, the March 19th event in Baltimore that's rapidly approaching, I think is going to be just the beginning of this project. And we're hopeful that it resonates with people in one way or another. Even if it empowers them to make a change internally with what they're doing to maybe get to a better place, or take a risk, or stand up for themselves, or say no to a task that they don't have capacity to handle, then that's a win. Right. So it's exciting. It's daunting too. Like some of the people I've gotten to meet and talk to, and doors that have been opened, and I've gotten to meet a lot of my heroes. I never in a million years thought this is what I would be doing as I recently turned 50. But then, I'm excited for what's next too. And in trying to embrace those fears as opposed to running away from them.
If I may ask, and by the way, I'm in Puerto Rico as well. So if you eventually want to expand there, I can definitely help.
That sounds like a fun opportunity
coming up for some physicians in Puerto Rico. So I would love to assist in showing, but we can talk about that later. In thinking about this documentary, and I know that like I'm like Erin right now, like my brain is spinning. I'm like, we need to record another episode on this and that. But if you could pick like one desired outcome that you have for this documentary, like what would you want the audience to step away with after watching this documentary?
Oh, there's probably a lot of ways I could answer this. I think I'll speak to it from an individual perspective, because we are in a time where people do feel helpless. They feel alone, at times to the ultimate loss. I just saw a headline that the number one cause of death in medical residence was suicide, and it just breaks my heart. I haven't dug into that, so I got to lean into that headline a little bit more. But I think the reality is, I want to impart that your voice does matter. Your words matter. Sorry, I'm thinking about one of my colleagues. So don't lose hope. Don't give up. Ask for help if you need it. And if you're in a capacity to contribute to positive change, then do it. Because together we can make a difference. If we don't believe that, it's not going to change.
It's a beautiful message. Thank you.
Dr. Otten, you have done such an incredible job opening up ideas and sharing your joy for medicine while practicing medicine, which I think seems like such a disconnect for so many healthcare providers these days, for sharing what happens when you get out of a silo and you connect with other change makers and disruptors, and even how you yourself are doing things that you never imagined, not just to help your own medical career, but to help everyone who's practicing medicine by sharing information through the documentary, through your Ripples of Change book. And I'm going to be listening to this episode at least a couple of times to squeeze out every little last drop of wisdom and hope that you're sharing. And I hope that our listener really can walk away from this episode with new hope and enlightenment and interest in the documentary, Suck It Up, Buttercup, The Trust and Betrayal in American Medicine. And can you share with our listener the different ways that they can connect with you?
Oh, of course. Yeah. So probably the best way to get my attention is through LinkedIn. I'm pretty responsive there. If you send me a direct message and I've got the capacity, I'll definitely get back to you. The website for the documentary is siubfilm.com. So Suck It Up Buttercup film.com ultimately. And then if you're interested in learning more about Ripple of Change, it's rippleofchange.us. But ultimately, if you're really wanting to get my attention, LinkedIn is probably the way to go.
Todd, again, leaving with my heart full, and I hope our audience is feeling the same way and staying with the emotion of hope in the future of medicine that affects all of us. And so proud of this work. I cannot wait to watch the documentary. I'm sure that everyone else listening is too, and see what I love already seeing our next conversation and talking about all that's coming up because of the documentary. And remember, all the links that Dr. shared are in the show notes. So go there and go to the websites, share. And with that, stay tuned because our next episode is coming right up.
Do you want exclusive resources and the opportunity to connect with us? Then visit createmeaninginmedicine.com now, where you'll dive deeper into how you can create meaning in medicine. And if you're serious about optimizing your results, take 2 quick steps now. Connect with us on the website and tune in to the next episode.